Yeah, it is actually very exciting and certainly a privilege to be working with Susan Lucci on getting the word out about atrial fibrillation, or AFib, which is a irregular heartbeat that can cause a clot to form in the heart and then go to the brain, potentially causing a stroke. Just having AFib five-fold increases your risk of having a stroke that is, because of AFib, likely to be twice as deadly and more disabling. And with over 2.3 million Americans having atrial fibrillation, it is very important for us to get the word out and educate people, as Susan can tell, because her husband was diagnosed about 10 years ago.
I was going to say, we hear these statistics and everyone hears it and goes, oh my goodness, but they'd probably never think it's going to happen to them or their family. Susan, how has this impacted your family?
Well, as Dr. WIllis said, my husband was diagnosed about 10 years ago with this condition, this atrial fibrillation, or AFib, which is a kind of irregular heartbeat. He had no symptoms, and he was not a candidate in any way for AFib. But thank heavens we found out that he had this condition, because, as Dr. WIllis said, you know, the results can be a deadly stroke or a disabling stroke. So you need to know if you have AFib. I mentioned that my husband didn't have any symptoms because 2.3 million Americans have been diagnosed with AFib, including my husband. But all you have to do when you have your checkup is ask your doctor to also check your heart. That's important because you, like my husband, may not have any symptoms, but you need to know if you have AFib, because you certainly don't want to take any chance to go ahead and get that stroke. The good news, and that's what we're here to do, is to give you the good news, is that there is now a website called facingafib.com, which wasn't there 10 years ago, but now here's this great website, facingafib.com, where you can get all the information you need. You can learn everything you need to know about the condition, and then take that information and go to the doctor with your loved one, or maybe it's you who has AFib, and ask the pertinent questions so you can manage that condition together as a team.
Is that a part of the Facing AFib pledge, is going to the website and educating yourself?
Absolutely, and it's very simple. Just go to the website, facingafib.com, and with one click, you say you're going to make the pledge. And the pledge is simply to learn everything you can about the condition, and then go to the doctor with that information and ask the question so that you can be serious about stroke. You can really cut down on your risk of getting stroke. And the third part would be to spread the news, spread the information to people, because you could be like my husband, walking around not even knowing that you had AFib, and that could be very dangerous and could indeed change your life. As it is, because we knew about the diagnosis, we got the information, we've gone to his doctor, and that is a regular kind of occurrence. His condition is manageable, and your doctor can set up the routine for you that will help you lead a normal, healthy, fabulous life.
I love the message about being proactive. I want to ask, some people are afraid to be proactive and to look into what possibly their future might be because they don't want to necessarily face that. So let's put it out there right now. You get this diagnosis, what are some of the changes you might need to make in your life?
Well, some of the changes are certainly going to be related to the specifics about your care, but it may be medicines. It certainly is going to be lifestyle and dietary change, activity. There's a lot of different answers that you have to give based on the person, but the encouraging news is that afib.com actually has a part of the website is you can actually get questions to take to your doctor. So you don't have to be in the dark about this. And there's even an interactive book that you can get so that you can really be informed and understand how to have this conversation with your provider so that you can make a difference and stay healthy like Susan and her husband have done.
Obviously,
and I love that there's this book which is free and interactive. I love what you said, Dr. WIllis, about how going to facingafib.com really gives you the questions to ask. I mean, sometimes it can be intimidating. You think, well, I don't know what to ask. I want to help my husband or my wife or myself, you know, really manage the condition, but I don't know which questions to ask. If you go to facingafib.com, you will find out the information you need to go and ask those questions from the doctor.
Well, I love this partnership the two of you have created. I think we've even spoken to you on this topic before, and some of the information sounds familiar, so you guys are doing a great PR job about spreading the word. If you don't mind, Susan, I feel like this interview would not be complete on the viewer's end if I didn't ask about All My Children, the show coming to an end, and what's next for you?
Oh, thank you for asking. I don't think it's really sunk in yet that All My Children will come to an end sometime in September. So we've got 4 more months ahead, some great story plans, some beloved characters coming back. We really want to give this as a gift to the fans. As for what I'll do next, I don't know. It's exciting to think about. Sad to, I can't even imagine leaving Erica Kane behind, but if that's what the network has decided, I guess it's got to be. But I don't know yet exactly what. But I will keep performing because that's just who I am, and I want to continue to do that.
Well, congratulations to the show on recent 13 Emmy nominations.
Yes, and thank you.
Congratulations to you, too, and Dr. Willis for the successful PR campaign. Our best to your families and your husband, of course, as well. Thanks for your time today.
Thank you so much, Jennifer.
Thank you.